Most managers say they care about their team's mental health, but why are their teams still burnt out, stressed, calling in sick, or afraid to speak up? We're going to look at a few articles here today because there's a few articles that touch on this. One from Howden, Helping Managers Lead with Care, Why Mental Health Starts with Them. And if you're a manager, this is really important for you to understand in terms of supporting your team and supporting your colleagues with their mental health. And mental health and well-being is just a part of everyday living. We all need to support our mental health, just like we need to support our physical health. And it's really important that managers are there to support their teams. Now, of course, for deeper, more serious issues, there is HR, and HR should be able to be relied upon to help with more serious cases. But I want to talk to you about why managers are so important in supporting mental health in the workplace. So let's start by looking at this article here from Howden. We've got a few that I want to show with you about why it's so serious. But line managers sit at the heart of every organization's wellbeing strategy. They see what's really happening day to day, the pressure points, the team dynamics, the moments when someone just isn't themselves. But while most managers want to do the right thing, few feel equipped to handle sensitive mental health conversations with confidence. And many managers don't actually know where to start, how to have these conversations, how to support their teams. And mental health has been on the corporate agenda for years, but the way we work today has reshaped the challenge. According to Unmind Workplace Mental Health Trends 2025 report, 91% of UK HR leaders now see employee mental health as important to business success. And as someone who helps companies support their employees with their health and well-being, I've seen in companies how much little actions and little moments can really go towards supporting individuals. How small words of encouragement can make just a massive difference to individuals and how they feel in their job role, how they feel supported in their job role. Most mental health strategies still focus on reacting to problems. It's not about reacting to problems. It's about preventing them. Your organization needs to have systems and methods in place to help prevent it. It needs to have continuous things that help support people throughout, not just a one-off. Prevention starts earlier in everyday conversations, regular check-ins, and creating a space for people to talk before they reach crisis point. In fact, I know someone at the moment, personally, a good friend of mine, going through a terrible mental health crisis at their job. They haven't received the support. They've been signed off work for a long period by their doctor. They're actually not worked for nearly 2 months now. And this is just not good for anyone, right? It's not good for the organization. It's not good for the individual who's going through this mental health crisis. And companies need to do more to prevent it. And managers are the first port of call. Now, before I want to come back to this article, because I want to show you something from Forbes, because Forbes have an article on this and they've got a statistic here. Managers have just as much of an impact on people's mental health as their spouse, and even more of an impact than their doctor. 69%. 69%. Managers have just as much of an impact on people's mental health as their spouse, both 69%. And whereas a doctor has 51% or a therapist 41%. So managers have a massive impact on employees' mental health. If you've ever had a bad manager, you know that they can make or break how you feel about work. And actually, there are some shocking statistics when it comes to mental health. Let's look at some of the statistics over the last year from the HSC, because work-related ill health, 52% of work-related ill health was due to stress, depression, or anxiety last year. 52%. So 52% of the reasons someone took time off work was because of a mental health issue, one being stress, depression, or anxiety. And if we come down here to look at the specific work-related stress, depression, or anxiety, we've got 964,000 cases in the UK. 964,000. So let's just round it up to 1 million. Yeah, let's just for argument's sake. And I want to show you the number of people in employment in last year or this year, 2025. Just under 35 million. So that's 1 out of 35 people. If we're, quick maths, 1 out of 35 people had to take time off work due to stress, depression, or anxiety. And if we go back to the statistics here, that equates to 22.1 million working days lost due to stress, depression, or anxiety. And managers can have a massive help to reduce statistics like these. So let's go back to the article here from Howden. So managers don't necessarily know how to support their teams with their mental health. So how can we help managers with that? Well, simply with training that builds confidence and connection. Effective training does more than tick a compliance box. It should build emotional intelligence, awareness of company resources, and practical confidence to start well-being conversations. Good programs cover how to spot early warning signs of stress or burnout, approaching sensitive topics with care and respect, understanding policies on absence and return to work, and knowing what benefits and tools are available, such as employee assistance programs or well-being apps, and encouraging open dialogue that normalizes conversations about mental health. In fact, tomorrow I'm with a team of leaders, 28 leaders to be precise, and we've got a session on coping with stress and how we can harness gratitude to help support their teams and their colleagues. One of the big reasons many individuals don't enjoy their job or feel their managers are impacting their mental health is they don't feel appreciated. If you're a manager, how often do you showcase your appreciation to your teams? And I've got, a fantastic workshop that I'm delivering tomorrow for one of my clients, which I'm really looking forward to. But as this article says, training shouldn't be a one-off. Regular refreshers, peer support networks, and opportunities to share experiences help build a culture of care that lasts. And some organizations go further, introducing well-being champions or mental health first aiders to complement line manager training. So do managers have an impact on mental health? Absolutely. But can they have a positive impact? Absolutely. Putting on sessions, putting on moments where teams can come together and connect, understanding the policies where you can signpost people when they're struggling. And lastly, turn training into impact. This article here. The return on investing in manager training isn't just financial. When managers are empowered to support well-being, teams are more engaged, resilient, and loyal. Problems are resolved sooner, absence falls, and performance improves. And this one here, loyal, from the companies that I work with that have really good initiatives that support their employees, loyalty is a massive factor. I've seen people stay in companies for 20 plus years because they just feel supported in their job role. They feel supported in their company. So training and supporting mental health isn't, a tick box. It shouldn't be a tick box. It's an essential. Now, if you're new here and we haven't met, my name's Tyler. I'm the founder of an organization called Love and Life. We help companies support their employees with well-being workshops, webinars, and we've got a team of chair massage therapists as well. Head to the website, but all the articles mentioned in this video are linked in the description box. And if you want to join the mailing list where we send out free resources every few weeks to help companies support their employees with their well-being, that link is also in the description box. But remember, a happy workforce is a productive workforce.